Good evening. My name is Garrett Norris. I'm a deputy with the Watauga County Sheriff's Office. I've been a deputy for just over 6 years now, and I'm also a paramedic in the state of North Carolina. I obtained my EMTB, which is EMT Basic, in 2002, and recently graduated to a paramedic in 2018. Last year, I responded to an overdose where the patient was lying pulseless and apneic in a bed. He was sweating profusely and turning blue. As a law enforcement officer and a paramedic, we're trained on the administration of Narcan. Narcan is a reversal drug for opioid overdoses. The patient, who is a chronic drug abuser and has been administered Narcan several times in the past, lie motionless and helpless because of a decision that he made to try to reach a high that he had once felt before. He increased his dosage. He may have stepped up his game and went to a more potent narcotic. But the problem with this, they attempt to mimic the effects of a first-time use. And that feeling is never granted the same as it was once before. So I quickly performed a head tilt chin lift, which opens the airway. I assembled my Narcan kit and administered 2 milligrams of Narcan. The patient began breathing and became agitated while he was becoming more alert, unknowingly what he had taken, and wasn't even familiar with his surroundings. Narcan is a short, fast-acting release that will reverse the effects for a short period of an opioid overdose. It allows for patient care and an ambulance service to transport the patient to the hospital where he or she can receive definitive care. Being trained to administer Narcan will ultimately benefit society and allow for a second chance. There are many things to consider other than Narcan administration, and these things we will discuss along the way. The first point that I'd like to discuss is harm reduction. Through proactive approach, community-based practices, and syringe needle exchange. In response to the opioid epidemic, Naloxone distribution programs aim to prevent overdose death by making Naloxone available and training people to use it. Peers of individuals at risk of opioid overdoses are well positioned to administer Naloxone and prevent opioid death. Harm reduction efforts have focused on making Naloxone or Narcan more accessible to the public. First responders like law enforcement have been well equipped in the administration of Narcan and can administer it upon arrival if they are subject to an opioid overdose situation. Challenges do remain with first responders because most people do not want to notify law enforcement because they have an illegal substance in their possession. One of the things that we try to combat is each overdose situation that we respond to, we try to help these people understand that through the Safety Act, that we're not going to charge them for the narcotics that they have, that we're just going to dispose of them. Our primary concern is to help these individuals and give them the resources they need to kick the habit that they are choosing to take. This is part of the proactive approach. Community-based practices. There are many people in the community that have the ability to give Narcan. There are places where Narcan is readily available for distribution through maybe the Hunger and Health Coalition or the health department, places like that. And then there's the syringe needle exchange program. This isn't obviously to help reduce the amount of overdoses or to diminish the amount of narcotics used, but syringe service programs are comprehensive in providing health care and other assistance to persons who inject drugs, providing sterile equipment to reduce the transmission of diseases or HIV and hepatitis C, and it reduces needle stick injuries among community members. This means a reduction in the number of dirty needles discarded in public areas, which reduces the risk of disease transmission. Some overdose statistics that we have and the impact on the communities. Exposure to different medications can lead to a higher risk of overdose. The effects on overdose continues to impact communities in several ways. Some of these statistics from 1999 to 2007, more than 702,000 people have died from a drug overdose. 68% of those involved have died from an opioid-related overdose. On average, 130 people die every day from an opioid overdose. Exposure to more than one drug can also lead to overdose risk. Some of these prevention measures that we are taking into consideration are these naloxone distribution programs, law enforcement assisted diversion through the court system, peer administration of Narcan, and providing training on how to use Narcan. Right now, every deputy in the Watauga County Sheriff's Office is trained on the use of Narcan. What is the purpose of administering Narcan, and how can it affect the overall health and quality for life? Naloxone, like I said, it's a short-acting reversal for opioid-related overdoses. The routes of administration are intranasally, intravenously, and interosseous. Those are the three routes of administration. Side effects can cause nausea, it can cause headaches, and different things like that. But like I said, it's short acting, so when an ambulance arrives and begins their patient care, the medics begin their patient care, more than likely they're going to give another dose of Narcan so that the patient can make it to the hospital where they can get definitive care. So what to look for in an overdose situation: you want to look for constricted pupils, shallow breathing or no breathing at all, and evidence of needle injection, paraphernalia, or drugs present. All of these things that I've talked about are beneficial in reducing the number of overdoses that a community will be impacted by. Harm reduction, Narcan, prevention. Imagine falling victim of an overdose or witnessing an overdose and not being able to do anything to prevent death or lasting effects of opioid abuse.